Participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
It's not easy. And a lot of people think that having the surgery is the easy way out, and I will tell you that it's just the beginning of a lifetime change.
This local woman made that change and chose weight loss surgery to help with a host of health problems. Did it work? Well, you'll hear from her in just a minute. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today, our experts will be answering your questions on weight loss surgeries, also known as bariatric surgery. The most common procedures are the lap band, gastric sleeve, and gastric bypass. If you're watching us live now and you have questions concerning bariatric surgery, give us a call and your questions may be answered here live in our program by our experts. Those experts answering your questions are Terry Whittle, a patient who has had the bariatric surgery, and she'll be answering your questions from a patient's perspective, and Dr. Peter Nong. To call us here at Rex on Call, just dial the number on your screen in Wake County, 919-744-3876. And outside of Wake County, call toll free at 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions to rexoncall@rexhealth.com. You can even find us on Twitter. Send us a message at Rex Healthcare, #RexOnCall. So lots of ways to get in touch with us today. While you're calling in with those questions, let's hear from Terry Whittle. Bariatric surgery has helped her lose weight, but most importantly, it's given her life back.
While everything in Terry Whittle's refrigerator is organized for quick, healthy meals and snacks,
I have my eggs hard-boiled and ready to go for breakfast in the morning.
this shelf is reserved as a reminder. Terry underwent bariatric surgery 14 months ago. Before the surgery, her diabetes and other health problems had her on a constant schedule of medication. These insulin shots, 8 times a day.
It really was a deal that I made with the Lord and said, I would really like to be rid of these injections, and if this surgery can do it for me, then that's all I care about. Don't care about the weight. And then a month later, I said I'd like to renegotiate. I wouldn't mind losing a little bit of weight.
For Terry, bariatric surgery was the answer. She says it's a lifetime commitment.
It's not easy. A lot of people think that having the surgery is the easy way out, and I will tell you that it's just the beginning of a lifetime change.
Now all of her food is weighed and put into snack-sized bags before it hits the pantry.
You've got to put groceries away when you come home from the store anyway. Why not just pack them at that time? I will then add until I get an ounce of nuts and then put them in my little bag. And I'll do that with the entire can so that I don't have an excuse to pick this can up and eat until I'm sick.
She packs tuna and avocado for lunch along with healthy snacks. She works full-time as a transcription team lead for Rex Hospital, and she's working toward her master's degree. Even with her busy schedule, she finds ways to keep moving. She does some arm curls at her desk and a quick exercise DVD as soon as she wakes up.
It's a 15-minute exercise program. I do it then, and I do it when I get home from work. Change into my workout clothes as soon as I get home. And if I don't go to the gym, I will use the exercise tape. And then again, before I go to bed, it's the last thing I do.
This new lifestyle has given Terry her life back. She has the energy to travel to see her 3 grandchildren.
I think probably one of the neatest things for me was the first time my granddaughter came out and hugged me and said, "Tata, I can put my arms all the way around you now." That was really sweet.
Terry has donated most of her old clothes as she continues to shed the pounds. But this shirt, the same one she wore at her 60th birthday party, could fit another half of a person.
I have lost approximately 60 pounds, but even more important than that, I've lost 8 medications 3 times a day and 8 shots a day, which is, for me, I'm a winner.
Congratulations on your success, and I know we'll get a lot of questions from folks wanting to know how you did it, but like you're saying, it wasn't an easy fix.
That's right, it wasn't.
Yeah.
We really struggle every day. It's another day to just, keep it going, keep the motivation going.
And Dr. Nong here was your doctor.
He was.
And so talk to us, I mean, she had some real serious diabetes issues. Talk to us about the growing role of bariatric surgery and as a cure, possibly, for diabetes.
Well, it's interesting. 20 years ago, when they started doing bariatric surgery in its current version, they started recognizing that it was impacting other diseases other than simply obesity. And it was at that point that many scientific researchers, particularly in surgery, were looking at the possibility that surgery could actually be a cure for diabetes. And now we're seeing literature supporting that coming out recently, really talking about diabetes being addressed surgically as opposed to purely medically.
And what is it about the surgery that is a cure, could be a cure?
Well, I think when we look at how we treat diseases in general, we're often putting Band-Aids on the disease instead of addressing the underlying disease. And what bariatric surgery does with diabetes in mind specifically is actually affect the hormones directly. For type 2 diabetes or adult onset diabetes, often obesity impacts your insulin resistance. And in fact, it's not an issue of not making enough insulin, it's your body's not sensitive to it. By shifting the hormones, directing the food in a different pathway, we've actually changed the sensitivity of your body and the receptors to the insulin, and allows us to then cure people often, just like Terry.
And so Terry, talk to us about you're no longer on insulin.
Right.
How soon after surgery did you get off insulin?
Well, I was actually on 2 shots a day, one in the morning and one in the evening for about 4 months. I had been on insulin for a long time prior to the surgery, so I think that the longer you're on, the longer it takes you to get completely off. But by October, my doctor and I had the surgery in March. By October, my doctor said, we're ready to give it a try. Mm-hmm. So that was when I took my last shot, right before I left for France.
Okay. Now, and now you work to mentor patients who are considering this surgery.
Well, I enjoyed doing that through the support group that Dr. Nong and Dr. Sharp have one Thursday out of every month. And I've become friendly with many of the people who are either waiting for the big day or have had it and have questions. So that's really a nice way to go.
Now, if you could explain, Dr. Nong, really quickly, what are the differences between, a traditional gastric bypass and a gastric sleeve?
So the 3 operations that are most commonly done are the gastric bypass, the sleeve gastrectomy, and the lap band. I guess really in short, all these operations offer one of 2 basic functions. One is the idea of restriction, making your stomach smaller, and all 3 operations do that. The gastric bypass makes a small pouch of the stomach about the size of an egg. The sleeve makes a long, narrow tube of the stomach, and then the band actually puts a plastic tube around the upper part of the stomach to restrict. Where they differ is in the bypass, they actually bring a small piece of the intestine up so the food has a pathway to go, and that bypass also prevents food from passing through the first part of the small intestine called the duodenum, and that offers the big hormonal effect. Okay. The sleeve gastrectomy is simply, we make a small narrow tube of the stomach and there's no bypass, and the band is simply placed along the upper part of the stomach. So those are the basic differences.
Okay, and I know we're going to get questions on who decides what surgery you're going to get, and that is going to be right after the break. Give us a call here at Rex on Call. We'll be back. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions about weight loss surgery. If you have questions, call in now. In Wake County, call 919-744-3876. Outside of Wake County, toll free 877-277-6252. Or email us your questions at rexoncall@rexhelp.com. Let's get to these questions. We got a stack. This is from Mary Lou in Tarboro. What are the requirements to do the surgery? She's 190 pounds, diabetic, high cholesterol, high blood pressure. She's 63. Would she qualify?
So the qualifications were really set out by the NIH, really consensus statement back in '91, and they're in evolution. But I think the basics really have to do with a term called BMI, or body mass index. We really don't use your weight because you can be 300 pounds and 6'5" or 300 pounds and 5'1", and they mean very different things. So BMI, and if you look on our website, rexbariatrics.com, we have a calculator that you can insert your information and your height and weight, and it'll tell you. But basically, if you have a BMI of 35 to 39.9 and you have one comorbidity, such as high cholesterol, high blood pressure, diabetes, or sleep apnea, you would be considered a candidate. Or a BMI greater than 40. And greater than 40 regardless if you have no other diseases, because we know the mortality related to obesity at that stage is 8 to 10 times higher.
Okay. And this question is from Sharon, and you could probably help us with this, Terry. She had the Roux-en-Y gastric bypass a year ago. Any suggestions for getting enough protein? You do a good job with your protein. Tell her how you do it.
Well, I'm thinking of all the kinds of things I have in my refrigerator most of the time. Things like hard-boiled eggs, deli meats, the lean deli meats with cheese, low-fat cheeses. Nuts are a great source of protein. Avocado, Greek yogurt. But nutritionists give us great information about that, and most people who have had the surgery have had contact with nutritionists who really supply us with tons of great ways to get that protein in.
Yeah.
So.
Okay, this is from Deborah in Raleigh. Gastric bypass. Congestive heart. She's a patient with congestive heart failure. She has atherosclerosis. Sorry about that. Can she have the surgery? She can't walk or stand.
You know, we frequently see patients with all sorts of comorbidities. As we know, obesity contributes to heart disease, heart failure, and each patient is individual. We can really determine that better on a one-on-one evaluation.
Right.
We're typically, you know, our goal is to be ultra safe with every patient, and that means referral to cardiologists for them to assess safety from your heart disease standpoint. If it takes evaluation by a pulmonologist or other specialists, we do that in preparation for surgery. I would tell you that those disease processes do not exclude you from being a candidate. What we'd have to look at really is the big picture.
Okay. This question from Elaine in Lewisburg. Her 16-year-old daughter is borderline diabetic, taking medication for that. 5'2", weighs 260. Would the surgery help her?
So this is a growing area of research right now. I would tell you that we believe that in the pediatric population, and that's where her daughter would fall, we do not do surgery in our facility, and that's generally being done at institutions where they're doing it under a controlled study. We do see that there is benefit for children, but the debate is what is the right operation and when is the right time to intervene, because there's much more involved in the decision-making process. But it does work. It just involves choosing the right location and the right surgeons to take care of you. Okay,
this is from Lena in Raleigh. If she's apparently has trouble with anesthesia and it's hard to put to sleep, can you have surgery?
Absolutely. Again, part of the process of evaluating every patient is being sure that every aspect of their care is being monitored, including the anesthesia care. And we have specialists at Rex who help to evaluate that to make sure that this is a very safe procedure for every patient.
Okay, this patient is Helen from Fayetteville. She has diabetes, she's overweight, hypertension. Lap band or gastric bypass, which would be best?
So this is a question we answer frequently. I don't think that we can tell any individual patient without knowing more history what the right operation is. I can tell you this, that the old philosophy of you just choose an operation and we'll do it is gone. We do feel like every patient needs an individual choice, because there are different challenges that you may have, whether they be an ability or inability to exercise, limitations with dietary intake, nutritional challenges. All these things come into play in deciding what is the safest operation. So definitely not a one-size-fits-all approach.
Okay, good advice. Now, bariatric surgery has been around since the 70s. Many patients have had great success, while some have regained the weight and have actually had the surgery again. In the headlines recently, singer Carney Wilson chose to have something called band over bypass. In an effort to lose weight, she gained back after her initial procedure more than a decade ago. We talked to Dr. Paul Enochs, with bariatric specialist of North Carolina, about what happens when the patients want another surgery.
What we have found is there have been patients who had, say, a gastric bypass 5-10 years ago, where they found that they've gained some of the weight back. In those patients, If we have found that their pouch has gotten a little bit bigger, we can look toward reestablishing their restriction by placing a band over their bypass, and that is an option.
But Dr. Enoch says if the reason patients are gaining weight is because they haven't changed eating habits, another procedure is not a good option.
What we tell patients is that surgery is not a quick fix procedure. Surgery itself does not lose the weight for the patient. Surgery, whether it's the band, the sleeve, or the bypass, is a tool that when used appropriately by the patient can help them achieve the lifestyle and behavioral changes necessary to lose the weight.
Like many bariatric surgery offices, Dr. Enoch recommends patients undergo counseling before and after to ensure lasting results.
We have to determine, is the reason they're gaining the weight back because their anatomy has changed or because they're not making the right changes in their life?
Coming up, we're going to be answering more of your questions. There are a lot of them coming in. Give us a call in Wake County, 919-744-3876. Outside of Wake County, 877-277-6252. Give us a call. This is Rex on Call. Welcome back to Rex on Call here live on WRAL. You can reach us at those numbers on your screen. You're going to see those numbers? Yeah, we'll show you those numbers. There they are. Give us a call. We're going to get to these questions. We have a lot of them. This one's from Melissa in Smithfield. She had previous bypass surgery. We just talked about that, and she's regained the weight back. Why do people regain the weight?
You know, I think Dr. Enoch spoke well to it. I mean, there are two common things that we look at. One is to make sure that the previous procedure hasn't broken down in some way. And in some of the older open procedures that they used to do, that's not an uncommon thing to find that the anatomy that we tried to reposition has moved back to its normal state. And that is one thing that can cause it. Probably, though, the most common thing, our term for it in the medical bariatric world is maladaptive behaviors, which is people basically, they lose the weight and they feel like they've conquered the obesity and they fall back into their old habits. And I challenge every patient to tell me, you know, are you exercising 4 days a week? Are you counting your calories and looking how much protein you're taking in? Have you sacrificed the soft drinks and the fried food? And more frequently than not, most patients end up, you know, confessing in a sense that they've gone back to their old lifestyle. And no operation can overcome that. So that's our real challenge.
Okay, and Terry, you're nodding your head over there. Here's a question for you, Terry. This is from Robin in Roxborough. Do patients have constipation problems after surgery? Is that something that you hear about?
Well, I think we do hear about it. We hear about that as much as we hear about diarrhea because it's again, their diet needs to be adjusted in a certain way. Sometimes constipation is those people who aren't exercising as much. That's what I have found. And once they kick up their exercise, that helps. And there's always ways you can change your diet to get a little more fat so that you do actually, not have that problem.
Okay. And this is from Nancy in Warren County. She was turned down at another hospital for bariatric surgery in 2010. She's battled with weight problems. Her BMI is not high enough. She doesn't qualify. Now, could she still be a candidate?
You know, the criteria are fairly strict, at least at centers of excellence, about what guides appropriate candidates. I think there are some changes recently from the FDA approving the lap band for lower BMI patients. We recognize that around 2/3 of our nation is overweight or obese, and about 1/3 is obese or having a BMI greater than 30. She probably falls in that category of that BMI of 30 to 35 that is very much a gray zone.
Okay. And you just mentioned the Center of Excellence. Rex Bariatric Specialist has received national honors for its weight loss surgery program. The Independent American Society for Metabolic and Bariatric Surgery has recognized the practice as a Bariatric Surgery Center of Excellence. Rex Hospital has been recognized as a Blue Distinction Center for Bariatric Surgery, a designation awarded by Blue Cross and Blue Shield companies to medical facilities that have demonstrated expertise in delivering quality health care. We're going to have a final round of questions here right after this break. Stay with us. This is Rex on Call. Welcome back to Rex on Call. We're taking your final round of questions here regarding bariatric surgery. This is from Ashley. Is there an age limit? She's 71 years old, wants to know.
No, there isn't an age limit, actually. There is an age minimum that we accept within our hospital, which is 18, but there's not a maximum age. So it really depends on the patient's general physical health and their willingness and ability to participate in the program.
This is Jackie from Raleigh. If I have lap band surgery, how long will I be in the hospital and what's the recovery time?
Well, lap band patients typically go home either the same day or the next day, so it's a very short recovery. Overall, we ask folks to recover over the course of about 2 weeks, though. So we do want people to exercise, work on focusing on their diet and themselves.
Okay, this is from Veronica. Her BMI is 40. What's the best fluids to get her prepared for the surgery? Now, Terry, you told me about 2 weeks before you were on a liquid diet, right?
Right, that's right. And it's a medical protein, medical quality protein. So that, and after the first day, you don't really feel as though you need anything else. And you can be around cupcakes and parties and all kinds of things and still feel like you're getting what you need.
Oh, I need some of that. Yeah. I'm just kidding. This is Margarita in Chapel Hill. How overweight do you have to be? We've talked about this. But she also wants to know if a cancer patient is able to have this surgery.
Absolutely. Cancer patients are absolutely candidates. I think there are obviously other issues related to where your cancer is and what stage and how you're being treated, but actually cancer is one of those many diseases that are worsened by obesity. So.
Okay. Now, is bariatric surgery for anyone who's struggled with weight, and what would be, this is a question, what's better, but this is lap band versus bypass in terms of, and this is also a question, how do they get started?
Mm-hmm. Well, you know, I think this is a great question because really many people struggle with obesity. We want every patient to work on diet and exercise and their best effort with their doctor to lose weight on their own. But we recognize that the vast majority of patients, that if you have over 100 pounds to lose, your success rate is going to be less than 12%. And we know that the success rate with bariatric surgery is greater than 90% to lose more than half of your excess body weight. So, you know, I would encourage you to come to an education seminar, learn more about it, and that'll give you an opportunity to learn the details about the surgery and how it might help you.
Okay, so it's, and that's where you work. You've been mentoring folks before the surgery. And what are their biggest questions?
Oh, a lot of the questions is do you have to give up? What do I have to give up? How do I have to change my diet? Do I have to give up soda? Can I still drink? You know, that kind of thing. So,
and the answer is yes, you have to give up soda, right?
well, there's a lot of things that we give up because it's better for us, and you don't miss them. It's amazing that you don't miss those things. And complex carbs are another big issue too, you know, breads and pastas and that kind of thing.
Okay, and we are getting a lot of questions in terms of insurance coverage. Talk to us real quick about insurance coverage for this procedure.
So, you know, I think it's hard to simplify answering how your insurance would apply here. I think the most important thing would be to, number one, talk to your insurance company, find out if you have coverage and if your specific plan includes that. And we can also help you if you come to our education seminars. We have experts that can help guide you through that process because it can be very confusing for patients.
Okay, and if you've called today, there have been a lot of calls that we unfortunately didn't get to, but we have your information and somebody with your office is going to follow up so we can talk to, maybe arrange meeting in some of those pre-surgery kind of, you know, learning sessions. Okay, as always, consult with your physician about any health concern. And there's a lot happening here at Rex. At the 2012 Rex Hospital Open is fast approaching. It's a premier golf tournament featuring golfers from the PGA's nationwide tour. It's a week full of fun with lots of